Good morning, or good afternoon. Thank you for joining us today. We on Saturday morning became aware of progressive issues with our IT systems in health, and it seems through discussions with Bell, our provider of those services at the data center, that we may have been victims of a possible cyber attack by a third party. This led to progressive failure of what's been described to me as the brain of the data center and a loss of functionality in systems across the regional health authorities. Because of this, we activated our Provincial Emergency Operations Centre to more fully address the impacts across the system, whilst at the same time ensuring that Bell, Centre for Health Information, and the appropriate authorities were notified to look into the background to these failures. Our aim over the last 48 hours has been to mitigate the effects on the people of this province, to work on remediation, and to help where possible Bell rebuild their system. The same staff that have helped us through COVID in the regional health authorities, in the department, in the centre, once again stepped up, literally working pretty well round the clock given the nature of the problems. And I'd like to take this opportunity to personally thank every one of them because they have helped to mitigate significantly the impact. Each of the regional health authorities has been affected, but to a different extent. The maximum impact seems to have been wrought on Eastern Health's operations. They set up their Emergency Operations Centre, and that's one of the reasons I have Mr. Diamond here today to discuss some further implications there. Each of the regional health authorities, as I say, has been affected, but Western and Labrador Grenfell appear to be as near normal operations as any of them, with Central somewhere in the middle. Each of the regional health authorities has set up phone lines and a web page to convey information as it's available. But there's been significant impacts across the healthcare system for today, and those will remain to some extent depending on the background activities of our service provider and the Centre for Health Information. We have aimed to give regular updates now over the course of the next couple of days as we get them. This is a fluid and evolving situation, but for a more granular look at particularly Eastern Health's operation and the impact of that, I'll take the opportunity to turn it over to Mr. Diamond, the CEO of Eastern Health. Dave.
Thank you very much, Minister. This is, as you say, it's been a difficult few days, and lots of people within the regional health authorities and at the Centre for Health Information and within government working around the clock to try and mitigate a very difficult circumstance. I think people would have a pretty good understanding of how digital our health system is, and pretty much all of our systems at Eastern Health at the moment are not functional as a result of this particular outage. And that includes everything from registration. We can't register people electronically. Our email systems are down. Our patient information system is down. We're not able to access diagnostic imaging or lab results electronically. And so we have gone into contingency mode. We do have contingency plans for this type of situation. We always hope never to use it, but we have been putting those plans in place over the weekend. People will have seen, I hope by now, an announcement from Eastern Health, as all the health authorities have made announcements around service impacts, but for Eastern Health in particular, today we are doing only emergency procedures. Anybody who had a procedure today that wasn't an emergency procedure, that procedure has been canceled and will be rescheduled as soon as possible. So we're working on that rescheduling as we speak. So for today, we're doing emergency only. If you had a procedure and it is going ahead, you would have been contacted. But if you didn't receive contact, your procedure won't be going ahead today. We weren't able to contact everyone individually as we would have hoped because, of course, much of that contact information is in our digital systems and we weren't able to access. That is the circumstance for today. We are making the decision as we speak for tomorrow. We anticipate we will also be doing only emergency procedures tomorrow, and we will be evaluating later today whether that will go into Wednesday as well. And so we will continue to update the public on our services over the next 2 or 3 days. As we know, work is continuing, and we want to try and give people as much notice as we possibly can that whether or not your procedures will go ahead. There are some things, though, that will go ahead and won't be impacted, and I just would highlight for patients receiving dialysis, that's not impacted. Our community services are not impacted. Our mental health and addiction services will go ahead as usual, and the work around vaccines and testing is also going ahead. So that, I think, Minister, is where we are today. It's where we anticipate we will be tomorrow, and we'll make a decision shortly on what we're able to do on Wednesday.
Thank you, Dave. I'd just like to repeat that if you need emergency care, it is available. If you have appointments, to check wherever possible. We are working with the experts in this field to mitigate and rebuild, and we're working with the appropriate authorities to look into the ultimate root cause of all this. So with that, I think I'd like to turn it over to Leslie now to moderate the media inquiries. Leslie?
Thank you, Minister. We have 8 media registered for today's availability. The first 2 rounds of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Minister, several sources have told me that this is in fact a ransomware attack. Can you elaborate on the nature of this attack and what sort of demands, if any, have been made?
Thanks, Peter. At the moment, all we know for certain is that this is a possible cyber attack, and the nature and extent of it are still under investigation. It will take a day or 2 for that investigation to be completed, and I have as yet not received any further information beyond what I've just provided to you.
Why this attack now has gone more than 48 hours? Why is it that we are 2 days into this and we still don't understand the nature of what's happening here?
That's a good question. I am not a cyber expert or a computer expert at all. The experts who we have retained have not come up with me with a definitive answer. I am aware that Bell has had some other challenges. Whether or not these are related is not clear. And at the end of the day, it's important that we here in the Department of Health and Eastern Health and the regional health authorities focus on our priority, which has to be patient care and looking after the people of this province. So I'm leaving the experts and the appropriate authorities to do what they do best while we do what we do better.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Lots of people are concerned that their personal information has been compromised with this attack. What can you say to people who may be worried about that?
Thanks. It's certainly a concern of ours. We have no information one way or another about that at the moment either. What I can say is the Office of the Privacy Commissioner has been notified, and as soon as we have any more information, we will share that with him and with the public.
Mr. Diamond, you touched on it that this is affecting a wide range of departments. Can you give us a sense of just how many people at Eastern Health right now are unable to do their jobs because of this outage?
Well, I don't think there's anybody necessarily who can't do some portion of their job. As I say, we have contingency plans, which means we go back to a paper-based system, which is not very efficient and slow, and means, of course, that we've made the decision to do only emergency procedures. So there would be lots of people today within our organization who are working in a less than ideal manner, but they are doing everything they can within a paper-based system to keep people safe.
Our next questions are from Jody Cook with NTV. Please go ahead.
Hi there. I'm wondering if your IT crowd can tell you what's happening with other departments. So if this is potentially a ransomware attack, how are we protecting other vulnerable departments and systems across government and that the public rely on?
That is a good question, Jody. The security of IT systems across government rests with a different department, which would be Digital Service and Government. So I think that question will be better addressed to Minister Stoodley rather than myself.
And are you able to indicate to us if there's actually been a dollar sign attached to this, if it should be ransomware, what they're asking for?
As I say, all I know is this is a possible cyber attack. The nature of it has not been divulged or discovered with any certainty, so I can't actually answer that question. It's a speculative one, unfortunately, at the moment.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Why are appointments being canceled? You say you have a contingency plan to go back to a paper-based system. What are the main reasons for appointments being canceled?
One of the couple of the major difficulties in our discussion with our clinical staff is around access to diagnostic information. And so, for example, we can continue to do x-rays and CT scans, but all of that information would normally be reported, and we do thousands of those a day. So if we were doing very small numbers, it might be a bit of a different conversation, but we do thousands of those a day, and they get reported electronically, and similarly in lab. So these are two areas where that kind of diagnostic information for folks who work in the clinical areas, physicians and nurses and others, is a critical piece of what they do in the run of a day as they care for patients. So without ready access to that information, our clinical leadership have indicated to us that they think it would be far safer for us for a day or two or three while we're working through this to reschedule appointments rather than to try and, we couldn't handle the same volume at this point in time in a paper-based system, and they think it's safer for us just to reschedule, and so that's what we've done, taking the advice of our clinical leaders. Peter, I would say, I would say as well that that is an ongoing conversation, and so today and into tomorrow, we've canceled everything except for emergencies today, as we talked about earlier. There will be an assessment, though, as we go through today and into tomorrow to see if there are some things that could be done in a paper-based system, and it is possible over the next few days that we will be bringing some things back, either because our electronic systems are coming back or because we have reevaluated and find that there is an opportunity. So we will be looking to do as much as we possibly can in this time. It's just today we've taken the advice of our clinical leaders to say it's far safer to do what we've done.
Do you have a follow-up, Peter?
Sorry, I do, yes. Health-related phone lines are busy at the best of times. Have you done anything to add extra lines or staff?
Yes, we have added a new line, and I can repeat that number. We've publicized this 1-833-777-1276, and we have staffed. We brought in additional staff. I believe there are 5 or 6 additional staff that are supporting that line, and they were working there all evening into late last night to take calls, and they will be doing that for the duration of this particular issue.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. The purpose of a ransomware attack is to extract ransom. Is paying hackers to regain access to systems a possibility? What's the government's policy on that?
That's a very good hypothetical. We don't know that that's yet what we're dealing with, and certainly that would be a discussion we would have under situation where that pertained. At the moment, all we are aware of is that the nature of this possible attack is still under assessment. It's early days, and I don't actually have any confirmation of how it happened or what the nature of it is.
Can you say whether this cyber attack is similar to recent attacks that we've seen, recent ransomware attacks we've seen in places such as the United States? And if there is a difference here, can you explain how it's different from previous occurrences?
I certainly can't explain that because it's certainly a very technical issue. I would suggest that at the moment, on the information that's been presented to us here in the department and the centre, that we would not be in a position to answer that question at all. I don't know whether Bell, as the hardware folks, would be able to better answer that than I, but certainly I'm afraid I can't answer that at the moment with what we know currently.
Thank you.
Our next questions are from Michael Tutton with the Canadian Press. Please go ahead.
Hello. I'm wondering if you could give us a kind of a rough estimate, if not an exact number, on the number of cancellations that occurred today as a result of this attack.
I can give you a very rough, and it would be in the thousands. So I can't be more specific than that. But as you can imagine, with surgeries and cancer treatments and diagnostic imaging appointments and lab, we do thousands of interactions with patients on a daily basis. And so very many people, I'm sure, will find their procedures today being rescheduled. As a number that may exist somewhere in our organization, I don't have it readily at hand this morning. But it would be many. And the other thing, as the minister said, is this is a provincial issue, although the various RHAs have been affected slightly differently. But this would be an issue impacting patients from the Eastern Health region. Central Health is also quite impacted, Western not as much, and Labrador is impacted as well. And we also would have patients from around the province who would have been traveling today into Eastern Health who will also be affected. So it is a significant impact, there's no doubt about that, and the numbers would be quite large.
Do you have a follow-up, Michael?
Yes, for Dr. Haggie. You mentioned this may be... Hello? Yeah, you mentioned this may be a wider problem elsewhere in the country, perhaps, or could you just elaborate a little bit on that? What you know?
Not really an awful lot. Again, it's somewhat speculative, but we were aware of other issues. Quite frankly, again, some of my answers here may be speculative rather than fact-based, and I'm trying to walk that line because my role here is to be factual and provide you with what we actually know at the moment. And so if I've strayed into the realm of speculation, that's probably a fault of mine. So we know only what we know, which is that we have a possible cyber attack. It has taken out the brain of the data center, and the consequences of that, myself and Mr. Diamond have kind of blue-skied so far. Our main aim here between the department and the health authorities is to mitigate the effect and maintain some continuity of service for the people of this province who need treatment for which they cannot wait.
Our next questions are from Renelle Legros with All Newfoundland Labrador. Please go ahead.
I'm wondering what kind of impact there will be on the system if we go 3 days of only accepting emergency procedures. I know you just spoke that there's thousands of cancellations just today. If this goes into 2 days, 3 days, what sort of impact are we looking at?
Well, I think unfortunately through COVID and Snowmageddon and other incidents in the last 2 years, we have lots of experience with these kinds of backups. And so, we're hopeful that this will be resolved in the earliest possible time, obviously. our clinical leadership will already be thinking about the priorities within the cancellations today and tomorrow to ensure that they're rescheduled at the earliest possible opportunity. We've had pretty good experience even through the delays and cancellations in the early days of COVID, where we've now caught up. So we have some ability to do extra work weekends and evenings, and we have mechanisms that we have used for critical situations like the backlog from COVID, and I'm sure we will pull some of those tricks out of our bag again this time round, and people will get scheduled at the earliest possible time, and it may mean that we have to do some extra time to get caught up. There will also be, I'm sure, an ongoing prioritization, so anybody within that list who may not be an emergency case today but needs to get done in an urgent manner, that will be looked at by the clinical leadership in the various programs to ensure that those are the people that get rescheduled first.
The minister used the words, the brain of the system is down. At this point, does it look like we've lost any information?
Again, the short answer is we simply don't know at the moment. That is part of the kind of assessment of damage that's being done by our service providers and by the Centre for Health Information. Because of the nature of the failure, it's actually difficult to access that. And one of the thoughts I had as Mr. Diamond was commenting around, delays and numbers of cancellations is we would normally go to that system to find those numbers for you and have done during COVID. We don't actually have that opportunity at the moment, so we won't know until it's over and done with what the real impact has been.
Our next questions are from Leila Baudouin with The Independent. Please go ahead.
Hi, Minister. Sources call this a global chaos in terms of how many people it's impacting across the province. I want to go back to quantifying this. How many patients have been affected? How many records are on the line?
In terms of the IT impact, we don't have that information yet, as I just explained. In terms of the immediate effect on patients who have appointments and have to travel, again, this is being done on a day-by-day basis. Each of the regional health authorities has phone lines and access points for people to reach out. And absent the ability to query an IT system, again, those numbers will not become apparent for a little while. Once we get a full report from the Centre for Health Information and our service provider, we will be in a better position to be able to comment about what the state of some of the health records is or is not.
Did this happen because our system is outdated? If not, what do we know about why we were a target?
The last part of the question is I don't really know because it's not clear yet what we've actually suffered. We believe it's a possible cyber attack. In terms of systems, this is a managed service contract which is renewed on a regular basis by a provider that provides us with a state-of-the-art service. So I'm not sure that that's accurate there. I think we just do not know as yet what has gone wrong. And I think once we find out what has gone wrong, then we'll be in a position to better answer questions about hardware and the nature of the system as it was before the failure.
Our next questions are from Peter Cowan with CBC. Please go ahead.
There are quite a few people who have flown in to St. John's, for example, for either procedures or imaging that's required, only to now find out that their appointments have been canceled. What's being done in order to try and deal with them, considering they've already paid significant amounts of money to get here, and trying to prioritize to make sure that their procedures can happen?
Yeah, great question, Peter, and it's one of the things we've been thinking about over the last period of time is how to do just that. And so take my mask off, I guess, and speak to you directly. We have. I had a conversation just before coming into the studio with one of our clinical leaders who shared an example of just what you're talking about. Somebody who's flown from Labrador for a cardiac procedure, and so we will be working with each of those people on an individual basis to try and ensure we provide a procedure, get them looked after before they have to return, if at all possible. So as we identify who those people are and what they need, we are doing everything that we can on a case-by-case basis to ensure we get them the procedures that they need before they go back to Labrador, for example, or frankly anywhere else in the province if they've traveled long distances. We're trying to do that on a case-by-case basis.
You mentioned that COVID testing is still going ahead. Those systems, the systems that normally support that, are down. So can you give me an indication for folks who do need to get a COVID test and normally would have filled out an online form? What procedures should they go through, and how are people being notified of the results of COVID tests? Again, considering normally they'd go online to look that up.
Certainly from the point of view of COVID testing, we have asked and suggested that the RHAs move to a drop-in system for COVID testing rather than appointments. That way the sites are publicised and simply turn up on the day. Certainly positive results. The Chief Medical Officer of Health has made arrangements with the laboratory to use the old-fashioned system of the telephone to actually notify them, and then those people will be contacted by public health directly. My understanding is that there may be some partial access to negative results, but we're still trying to work through that and validate that. So at the moment, that's kind of the hybrid that we're in with COVID testing.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Minister, you mentioned that Central Health hasn't been affected as much as Eastern Health, and that they're somewhere in the middle in terms of impact. Can you expand on that? Can you explain what they're dealing with and what the extent of cancellations and impacts are there?
My understanding that is currently that their laboratory and diagnostic ordering systems have been impacted. So again, they're onto a paper-based system. Because of that, they will have put a hold on some blood work and some diagnostic imaging. The provincial X-ray archiving system, the PAC system as it's called, which shares images and reports across the province between radiologists and providers, is down, as is the digital telepathology system, which allows pathologists to share images of biopsies and those kind of things. So those will be done on a very much a local basis. It's not clear as of this morning what impact it's had on the outpatient appointment and scheduling software. Central Health run a slightly different system. So, for example, Monday's clinic, the clinic list would have been pulled off the computer on Friday. So there was some leeway there to use the paper to contact those individuals. They'll be working, and I will be advised later on of what the situation is for tomorrow.
And has the province considered reaching out to any of the other provinces or maybe the federal government for some help to help get the healthcare system through this?
We have reached out to national experts in the field of cybersecurity and IT. As I say, we are liaising with the appropriate authorities about whether or not what to do if this is a cyber attack. We have certainly discussed at a civil service level with the department, with Health Canada and the federal department about our situation. As yet, we feel we have the external resources available that we need. Should that situation change, we will change tack.
Our next questions are from Jody Cook with NTV. Please go ahead.
Thanks. So this is pretty clearly exposed a vulnerability. NTV News has been told that in past, the provincial government has been warned about vulnerabilities that exist within our security and software. Was there an effort to be working on beefing this up when this attack happened, or are we, reconsidering how we're operating here?
Certainly, we have through DGSNL a very active cybersecurity environment that's run by that department. So I couldn't speak directly to it. Certainly, from our point of view, when we do request for proposals and award them for outside IT contractors, there is a very clear expectation of very high industry standards around data security, encryption, and these kind of things. We live in a world where data and IT is part of the way business is done. Bell, as a managed service provider, are leaders in that field. So I think, could we do more? Well, ask us when the report comes back around what the root cause of this was and how it happened, and we'll be in a better position to answer that question.
Okay, so lots of conversation here today around the contingency plans. And Mr. Diamond, you've sort of indicated that really mostly looks like a pen and paper scenario. So is there actually a backup system?
The data center actually has two brains, and both of them seem to have been affected by whatever the system's failure was. In terms of local IT and the ability to work locally with electronics and infrastructure, there are capabilities that do still exist. It's a lot of the networking function that's been lost as a consequence of this failure. So the backups at local levels exist. There were backups at the provincial level, but again, part of what happened will be told when the full analysis is available from our experts.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hello. It seems like a technical briefing from an IT expert would have been quite useful today. Is there something that we can expect in the near future?
Yes, I would love to know more about IT, Peter. The challenge that we have at the moment is the IT experts aren't in a position to draw any firm conclusions as yet. Their work is, as they regard it, not yet complete. So I think until they have a story, a narrative that they can piece together, that I'm not sure what the utility of saying, I don't know, is by an IT expert. Because this is a very complicated process as far as I understand it. And certainly I would love to have an explanation, and I think that will come with the report that we'll get from our experts. And I think when that's available, we'd be happy to look at how best to present that information to you and the general public.
Is the province and or health authorities, are they insured for this type of thing, including ransomware?
HIROC, the Health Insurance Reciprocal of Canada, has been engaged since Saturday, so we will carry on with those discussions as this unfolds.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi again. It was put to me this morning by a cybersecurity expert that the speed of recovery from a cyber attack depends on how prepared the group or the organization that was attacked is. Minister, do you think we were prepared for this sort of cyber attack?
That's a really interesting question. I think between ourselves, the centre, and our managed service provider, we'll be in a better position to answer that when the system is back up and running again. This is a collaborative effort between the centre and our contracted provider. So I think those questions will be able to be answered in due course, because they would be in a better position to say what has been done in advance. As I say, our main concern at the moment from the department is to mitigate its immediate effects, remediate things, and get back to normal running as soon as we reasonably can. I think the post-mortem, as it were, will probably be a bit longer than that. And quite frankly, at the moment, I just want to get things back to normal.
Is it accurate to say that the government has no idea when this will be solved?
We receive our information on timelines for remediation from the centre and Bell. They are less able to give definitive timelines until they start and continue through some of the work. And again, it's not clear that they can provide an accurate timeline just at the moment. They are hoping for days, but, you know, we just have to bear in mind that that's a hope and continue to work on mitigation from the frontline point of view to deal with the impact on patient care.
Our next questions are from Michael Tutton with the Canadian Press. Please go ahead.
Would it be accurate or correct to say that lives are at risk as a result of this situation?
I think that may be a little bit of a stretch. We have the ability to dispatch ambulances. We have emergency departments that are open and staffed. We have the ability to provide care for those people who attend. I think we don't know what we don't know about the clinical condition of patients who are currently under assessment or under investigation. And that's one of our drivers to get this back to normal as soon as possible. So I think it's important that folk realize that we have people working on this, both from an IT point of view, from a clinical point of view. They've stepped up and they've done a really great job over a very difficult weekend. You know, as Mr. Diamond referenced at the beginning, we've seen Snowmageddon, we dealt with that. We've seen COVID, and we're walking through that, and the light is there at the end of the tunnel, and we'll get through this too. I think it's important that we remain focused on what we can do to mitigate while the experts do the rebuilding in the background.
And are health staff using computers at all? You know, with local area networks, and what are the limits of what they can use their computers for when they're working with people?
I think the short answer to that is yes. There is an ability to use local iterations, for example, of Meditech. We have no information about the community software that we use being affected. So people who are at home or in personal care homes, there is that ability. I know some folk in Eastern Health have had their email essentially switched off, whereas in Western and Labrador Grenfell, that's still working. So it very much varies.
Our next questions are from Renelle Legros with All Newfoundland Labrador. Please go ahead.
Wondering what kind of third-party assistance will government or the health authorities require to fix this, if any?
We have retained national leaders in this field, and I think that's a question we've asked them and not yet heard. At the moment, we're still in this kind of mitigation, remediation phase, and that nature of any help will become apparent as the situation evolves.
And you mentioned there have been individuals working around the clock on this. Is it too soon to discuss any sort of financial fallout we might see as a result?
I think the short answer is yes, it is too soon. So I think we just need to wait and see how things unfold over the next few days.
Our next questions are from Leila Baudouin with The Independent. Please go ahead.
Hi, Minister Hagee. What message do you think this crash sends to Newfoundlanders and Labradorians already dealing what many in this province call a healthcare system in crisis?
I think it says that we are just as vulnerable to system failures as other jurisdictions, and that despite planning, sometimes those plans go awry. I think we have responded rapidly. I think we are undertaking mitigation, and we have to rely on our provider and the centre to do the work behind the scenes to get the system remediated and, if necessary, rebuilt. It will be done. It's a cost of doing business in the digital age.
I know Renell sort of just asked about this, but can you tell us if the RCMP or the Canadian Security Intelligence Service is involved? And if so, can you talk a little bit about what they would be doing?
My understanding is law enforcement are aware, and no, I can't talk about what they'd be doing because, quite frankly, I don't know. That's their area of expertise, and the last thing they need is an amateur sticking their finger in.
I will now go back to Reach Reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do, for Mr. Diamond. My understanding was that several months ago, Eastern Health had a proposal into government to beef up its own cybersecurity details. Can you give me an idea of whether or not you received the government approval and what stage of implementation that project is at?
Yeah, thanks, Peter. So that's quite separate from this incident, but of course timely in some ways. We do have a proposal that we have been working on, which would see the creation of a healthcare cybersecurity center of excellence in the province. As I say, that's a very separate issue from this and comes out of work we're doing in our innovation strategy. And we've had great support from government. We're on I think there are 5 phases to our project. We're now in phase 5. And if all goes well, we would be looking for some final approval into the spring. So it's a separate conversation, not related to this in a direct way, but certainly going into the future might give us some additional capacity to think about cyber in the province in a bit of a different way. So we've had great support from government. It is an innovation project as opposed to a healthcare or project, but I think, might be helpful as we go into the future.
Richard Duggan with VOCM, do you have a final question?
Yes, for people out there now who are concerned about their health procedures and have questions about what's going to happen next, what's your message to them, and what should they be doing in the interim while this situation is being figured out?
There are contact numbers and web portals for updates, and so I would encourage them to look at those. If they feel their clinical situation has changed, then they have the option of either going back to their primary care provider for further advice or contacting the office of their specialist if they're under specialist care directly. And between those suggestions, I think they should get their questions answered.
Jody Cook with NTV, do you have a final question?
Thanks. Considering the scope of this and the potential implications, especially as far as personal information compromise is concerned, should people be changing their passwords? I mean, I actually haven't had a chance to check this during this call, but are people able to still go on MyGov accounts and change potentially exposed passwords right now?
I think regular changing of passwords is just good IT practice. Some systems force you to do it every 3 or 6 months. In the kind of home arena, though, it's often done once and it's the same password and it's your pet's first name. And I would suggest that that's probably not the best way of doing that. My understanding from MyGovNL and Minister Stoodley is that that site has not been impacted. So if someone wants to go and change their password and they've used the same one for a while, that's probably just a really good precaution.
Peter Jackson with The Telegram, do you have a final question?
Yes, ransomware is not actually new in Canada. Even this year, apparently there have been cases. And in those cases, about 2/3 of organizations actually paid a ransom. Is this something the government would consider doing? What is the policy on that?
That's, again, a speculative question. We don't know exactly what we're dealing with. It's a possible cyber attack, and we don't know the nature of it currently. In terms of policy, to be quite honest, I would have to check with my colleagues to see if there is a policy. I'm not aware that we have one as it pertains to health, but maybe DGSNL or Cabinet Secretariat might have an answer to that, but I certainly don't at the moment. I will go and check, though.
Thank you.
Patrick Butler with Radio Canada. Do you have a final question?
I do. Minister, previously you talked about, I'm going to keep with this brain analogy, that you said that the hack or the possible cyber attack affected the main system and also the backup, the second brain. Can you explain what that means? And would that indicate that the contingency that had been in place by the province was not sufficient to ward off this attack?
Obviously, there's been a failure and damage of that system. How that happened and whether or not the security that was in place at the time was appropriate and industry standard, those are questions to which I do not have the answer. We will obviously ask those questions ourselves of the centre and our provider. But at the moment, any answer I give to that would be ill-informed and just a speculation. So we'll find out, but it won't be tomorrow.
Michael Sutton with the Canadian Press. Do you have a final question?
When is your next briefing with your security folks, and when can you give us further update with your IT folks?
Certainly from the point of view of updates with our IT folks, I would say they've been pretty well constant since Saturday lunchtime. In terms of updates, we're certainly happy to provide updates as and when something material transpires. And so I can't say exactly when that will be. So maybe setting a regular time might be a bit ambitious just at the moment. But I think we'd certainly be more than willing to provide updates when something material changes. So it's a little difficult to put a timeline on it just at the moment.
Renelle Legros with All Newfoundland, Labrador. Do you have a final question?
I'm good, thank you.
Leila Baudouin with The Independent. Do you have a final question?
Yeah, Minister, I'm looking at a news release from 2009 from the Cameron Inquiry, and there's a line about making enhancements to the healthcare systems when it comes to things like public records. What do you think this crash today says about how the province has addressed our healthcare system and its enhancements?
I think the Cameron Inquiry was a very wide-ranging report, and to my recollection, I think we actually completed the last of those recommendations from Cameron earlier on in my mandate. In terms of the specifics around hormone receptors and these kind of things, there have been huge steps taken in that direction. And I referenced the digital telepathology system that is currently impacted by this failure. And that was really kind of the icing on the Cameron cake. So I think we have addressed those, and previous governments have addressed those since the inquiry report was received.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, thank you, Leslie. Again, I want to thank Mr. Diamond and the staff of the regional health authorities, NLCHI and Bell, who have really put in, 25-hour days over the course of the weekend, and I really appreciate the effort. We have a system that is damaged. We are there, though, however, if you are unwell or feel you need care. Ambulances are available and can be dispatched. Emergency care is available at emergency departments, and primary care providers and community care seems to, at the moment, have been spared. So I think the important thing for the people of this province is to realise that hands-on health care will continue. There is no reason why it cannot. It may not do it at the pace and the volume that everyone's come to expect, and that's the advantage, if you were, of digitisation and automation. This is another of those challenges that we have seen over the course of the last 2 years. I referenced Snowmageddon, referenced COVID, and just like we dealt with those, we will deal with this. It will take longer than I or anybody else wants, but at the end of the day, we will come out the other side. We will keep you informed as and when there are new developments and significant progress. But for now, I'd close and say thank you for your time and thank you for your interest. And to quote Dr. Fitzgerald, stay safe.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.